Welcome to the GMC's PLAB Objective Structured Clinical Examination, the OSCE. This video will explain everything you need to know about the way the exam works. The exam consists of 18 clinical scenarios. These will test you in a mock consultation setting to reflect how you would apply your knowledge and skills in real life. You may be feeling worried about taking the exam, but remember, you will have done most of the clinical tasks many times before with real patients. Members of our team are here to help you throughout the exam to make sure you have everything you need. Please feel free to speak to us if we can help you. The exam will be held at our Clinical Assessment Centre at 3 Hardman Square, Manchester. When you arrive, the person at the front desk will guide you to the GMC's 8th floor reception. At the GMC reception, present your ID or booking confirmation. Then select your name badge from the desk in front of the reception and hand it to the receptionist, who will check your name against your ID. It's really important you wear your name badge at all times, as it shows your GMC number, which circuit you are on, and the number of the station where you will start. You will also need to show your identification again for a further ID check, so it's important that you bring the correct documents with you. Your identification can be a passport, an identification document from the UK Border Agency, a Home Office travel document, or a UK driving licence. Remember, the document must be original and show your photograph. For information about these documents, please visit our website or take a look at the confirmation email sent to you via GMC Online. Wait in the reception area until your name is called. We will take you to a booth to complete your ID check. This will take no longer than 10 minutes.
There's your passport, and that's your identity check complete.
Once your ID check is completed, you must lock all your belongings away. Find the locker corresponding with the key number found on your name badge. You won't need to take anything with you into the exam, not even your own medical equipment. We will give you everything that you need. You will need to switch off your mobile phone and place it in the locker with all your other belongings, including any other electronic equipment, pens, pencils, reading materials and wristwatches. Whilst we offer secure storage, we cannot be responsible for your items, so please bring as few personal belongings as possible. While you are waiting for the other candidates to complete their ID checks, you can use the toilet facilities in the lift lobby area. Once we have completed all ID checks, we will take you through to the Clinical Assessment Centre.
Good morning, doctors. Welcome to the GMC.
A member of our team will talk to you about how the exam will work. The Chief Invigilator will also come in and talk to you and explain what you can expect to happen throughout the day. We have 2 circuits in operation at our assessment centre, a green circuit and a blue circuit. Once the briefing is finished, we will ask those with a green lanyard to line up outside the briefing room. We will ask you to line up in order based on the station number you are starting at. It is important that you do not move place once you are in line. Before entering the circuit, we will use a metal detector to ensure that there are no electronic aids taken into the exam. You will be guided through to the exam area where you will see a circuit of OSCE stations, each with its own number. You will be taken to your first station. Please wait outside this station until every candidate is in place. And then we will begin the exam. You will have 90 seconds to read the instructions and review any patient information that is displayed on the wall outside each station. At the end of the 90 seconds, there will be an announcement to begin.
Begin. Please enter the room.
And you may go into the station. Examiners will need to see your name badge when you enter the room so they can check they are marking the right candidate. You can then begin the clinical task described in the instructions. There's another copy of the instructions and patient information inside the station. After 6 minutes, there will be an announcement warning you that you have 2 minutes remaining left to complete the task.
2 minutes remaining.
Please stay in the station, even if you have already finished, and wait for the announcement to move on.
Move on to the next station.
You must now leave the station and go to the next one. You move on in numerical order. To help remind you which direction to move in, there are floor signs pointing to the direction you need to go. You have 90 seconds to get to your next station and to read the instructions there. When you hear the announcement to begin, enter the station.
Begin. Please enter the room.
This cycle goes on until you have visited all of the stations. The whole exam will take about 3 hours and 10 minutes. At some of the stations, you'll find an actor playing the part of a patient, relative, or healthcare professional. Where you need to carry out an intimate examination or invasive practical procedure, there will be a model or a mannequin. Some stations may have a patient simulator. This is a mannequin that can talk and has physical signs and symptoms. Act as you would with a real patient. There may be other equipment in the room that you would see in a clinical area, such as a monitor. Don't worry if the examiner doesn't talk to you much. They are there to observe, assess, and mark your performance, not to contribute. However, there are a few occasions when the examiner might speak to you.
Hello? Hi.
He or she may have a role to play, being a senior doctor on the telephone, for example. Or you may be asked for your diagnosis.
Thank you. Could you tell me your clinical findings, please?
All matters of
An examiner will also interrupt if you are about to cause pain to a patient, or if you aren't quite following the instructions of the task.
Doctor, could you read your instructions, please?
Two of the stations are rest stations. Here, there is no clinical task to carry out. It's a chance to take a break, to sit, relax, and have a drink of water. There may be an observer in some of the stations. The observer is there as part of the quality assurance process or in training as an examiner. You may also notice some cameras in the station rooms. We may record part of the exam, and staff will observe the exam for monitoring and training purposes. When everyone has visited all the stations, there'll be an announcement that the exam is over.
End of the exam. Candidates, please leave the examination hall.
When the exam is finished, you will be asked to leave the exam circuit quickly and quietly, as there are other exams taking place. Please collect your belongings from your locker and hand in your badge and locker key. It is important to remember not to discuss your exam with anyone. As part of the terms and conditions you signed up to when booking your place, you have agreed to not disclose exam materials and content. This applies even after the exam has ended. This means you cannot discuss the exam with your friends, family members, colleagues, or on social media. Failure to comply with this can lead to your results being annulled or any application for registration being referred to the Assistant Registrar. Please leave your mobile phone switched off until you have left the building. You will be able to access your results online via GMC Online. An email of your results will also be sent to your registered email address. Please make sure that your password for your GMC Online account is working, and if not, please call our contact centre for help as soon as possible. After the briefing, if you have any questions, please do not hesitate to speak to a member of our team. And finally, relax. You will have done most of these tasks many times before and with real patients in the real world. Don't forget, if you pass the OSCE, you will be entitled to book onto a free Welcome to UK practice workshop. Find out more by visiting our website